A distal radial fracture has two general types, both occurring at the distal radius about 1.5 to 2 centimeters from the distal end of that bone. The first is the Colles fracture, and in this type of fracture, the fracture segment displaces dorsally. The reverse Colles fracture, or Smith fracture, is when you have a distal radius that is being displaced toward the palm. There are 5 classifications of distal radial fractures you can see listed here. Type 1, 2, and 3 are more based on the type of mechanism that causes the fracture. Type 4 is the avulsion itself, and then type 5 is a combined fracture. The mechanism of injury is going to be fall on an outstretched, pronated, and hyperextended wrist. You're going to see these fractures more commonly in the elderly because they have a decreased bone density. When you see this type of fracture, the hand is in a pronated position. There will be a dinner fork deformity when the fracture segment is displaced posteriorly, creating that dinner fork type look in the x-ray itself. The fractured segment is shortened, and it disrupts the relationship between the radial and ulnar styloid processes, so doing a bilateral assessment is very important in this injury. The patient will complain of pain localized to the fracture site, which again is about 1.5 to 2 centimeters from the distal radius, and the person will be dysfunctional. Range of motion will be decreased for both pronation and supination, as well as wrist flexion and extension. Special tests will be standard of practice fracture tests. Neurovascularly, we need to really take a look at that median nerve. The median nerve lies in closer proximity to the radius and is susceptible to mechanical trauma due to the fracture. It's also going to potentially have some compression due to the hematoma and the callus formation during the healing process and the inflammatory process. So it's not just during the initial fracture, but as the healing process moves on. Treatment will be conservative casting. However, if necessary, surgical stabilization might also take place.